Nicole Atwood here, welcome back. In this video, I'm going to be showing you guys a quick alignment assessment that you can do at home. And again, if you haven't read all of the amazing information that I posted above about alignment, go read it so you have good background information of why we're doing what we're doing. Haley's here again to help with the alignment assessment. So if you're doing this at home, find a wall. You need a wall to sit up against. So I'm going to show you the alignment assessment with Haley here. So Haley is going to put her feet just a few inches away from the wall, and then she's going to just naturally fall back with her arms up like this. So she's just coming back. So you're just going to come back so you're against the wall. Now I have assessed Haley's alignment before. She has really good alignment, so I'm going to be kind of manipulating her to show you guys what it looks like when there's different alignment issues. So as I mentioned, two big alignment issues that we really need to focus on, especially during pregnancy. So we make sure the core is in priming position and also the pelvic floor, that we're not adding too much internal pressure because we already have a lot of pressure with that cute baby. So rib thrusting, so the rib alignment, and then pelvic. Do you have a posterior and anterior tilt, or do you have good neutral alignment in the pelvis? So right now what we're looking for, we'll assess the pelvis first. So again, this is good neutral alignment. As you can see, there's a very small space right here that Haley has. Our spine naturally curves, so there's going to be that small space. So I'm going to show you guys what you would look like if you had a pelvic tuck or a posterior tilt. So Haley's just going to tilt her tummy back so her pelvis is flat up against the wall. There we go. Yeah. So Haley has tucked her pelvis in. She's kind of went like this. And you can see now that there's not much of a space. It's kind of flat up against that wall. I can't really put my hand back here because she's tucked that in. So if you find that your pelvis is really smushed up against the wall, you're probably tucking a little bit. So you really want to untuck that pelvis. And then the opposite problem is an anterior tilt, where you take the pelvis and you actually tilt it outward and forward. So Haley's going to tilt her pelvis outward and forward, and you can see now how far away her pelvis is from the wall. That's too much of a tilt. So our pelvis has this natural spectrum that it's on, and we want nice and neutral. So I want Haley to find her neutral pelvis now. So she kind of relaxed into it. It's gone back to, there's that natural space. It's not smushed up against the wall, and it's not super far away from the wall. So that's the space that you want with the pelvis. All right, next we are going to focus on the rib cage. And this is a really important one, especially during pregnancy, because you think about it, our center of gravity changes. So I'm pregnant right now, my blood is still on the smaller side, but when our belly grows, our center of gravity changes, and so we're pulled forward, and so we tend to overcompensate by arching our back to kind of get back in position. But what happens is we take our rib cage out of alignment, and we create so much tension on that linea alba, on that connective tissue, that it tends to separate and to weaken more, and we damage it more. So proper alignment is so important to neutralize intra-abdominal pressure. And during pregnancy, even more so. It's always important, but even more so when you have a cute human growing in there. So Haley, she doesn't have a rib thrusting issue. It's called a rib thrust. Is what it's called a lot. And Haley naturally doesn't have the issue, but I'm going to have her show you what a rib thrust looks like. I also have pictures in this blog post that should be up above this video showing me with a rib thrust versus not a rib thrust. So Haley's going to thrust her rib cage forward. You see how and this is kind of where that posture versus alignment comes in, because good posture is often defined as shoulders back, chest up. But what that creates is a rib thrust. We've taken the rib cage out of alignment, and that's exactly what Haley did. So I want you to go back to your neutral alignment again, and go back to that rib thrust, and look what happens. She lifted that rib cage up, and now there's this big space. So when you're doing your own alignment assessment, when you're up against the wall, feel, is there a big space between your rib cage and the wall? If there is, then this is a rib thrust. And the goal is to have that lower bra strap up against the wall. So Haley is going to, and she naturally does this very well, the lower end of her bra strap is connected to the wall. There isn't this big arching space. We want a little bit of a space in this pelvis area, but that rib cage we don't. And so if you are finding you have this rib thrust, how do we fix it? Well, that's the big issue of fixing it. So go back to that rib thrust position. When you're fixing a rib thrust, you never want to force anything. You don't want to slam your tummy down and kind of force it down. It comes from the shoulders. It comes from dropping from the shoulders and relaxing. It's a very relaxing. So you're just going to relax into dropping that rib cage. Never force anything. And especially, we have tight shoulders a lot. And so our shoulders round, and we have to kind of force it and hold it. Never force anything. Everything should feel a little bit natural in that relaxing sensation. So relaxing into that rib cage so that lower bra strap is touching the wall. So to review really fast, good alignment, a neutral pelvis, there's a little bit of a space to allow the natural curve of the spine, and good rib cage alignment is that lower bra strap is touching the wall. There's not a big gap in there. And that is good alignment. So start practicing good alignment. If you have that rib thrust, focus on trying to relax down into it, letting that rib cage lower down. If you arch your pelvis or tuck your pelvis, try letting that neutral pelvis just fall into alignment, and you'll be benefiting you, your baby, and your body by doing this.